Which Medicare supplement should you pick? The Plan G, the Plan N, or maybe even the high deductible Plan G? Depending on your age, there are 10 to 12 different Medicare supplement policies you can pick from in most states. If you happen to live in Massachusetts, Minnesota, or Wisconsin, then they have state-specific Medicare supplement options. But it really comes down to just 2 to 3, thankfully. So in this video, I'm going to highlight each of the 3 and how they work. I'm going to reveal the pros and cons of each one, and I'm going to tell you who should consider each Medicare supplement option. Hi, I'm Chris Prang, the Medicare analyst, licensed insurance agent based out of Charlottesville, Virginia, and licensed in other states as well, which you will see later in this video, or you can simply go to the About section of my YouTube channel. My goal is simple. It is to help you make a wise and confident decision about all of your Medicare choices. And as an independent insurance agent, I can do that because I work with every single major insurance company that offers Medicare plans and some not so major insurance companies that offer Medicare plans as well. That allows me to shop and find the plan that is most suitable for you, not your spouse, not your neighbor, not your friend, and not an insurance agent. If today is your birthday, then happy birthday to you. I don't know who in the world said it, but a birthday is a reminder to celebrate the life as well as to update the life. In other words, live vicariously, beautifully, and excitingly, discover, love, dare, and act as there is nothing to lose. First, a bit about Medicare supplements, also known as Medigap plans. They have been around since 1966, shortly after Medicare started. They simply fill the gaps or supplement what original Medicare does not pay in whole or in part. So Medicare is your primary payer and your Medicare supplement is secondary. They are typically accepted wherever original Medicare is accepted, and that is at 97% plus or minus providers throughout the country. There are no provider networks. There are less prior authorizations and benefit denials compared to Medicare Advantage. They are standardized. That means the plan benefits don't change from year to year. What does change, however, is the deductibles, the copays, and the premiums for sure. But premiums do change every year, typically because you go up in age every year, or healthcare inflation, or the claims of the pool of people you are grouped in. And Medicare supplements are the same regardless of the company you get your policy from or what state you are from, unless you live in one of those 3 states. By the way, if you like the content in this video and you find it helpful, please consider subscribing to the channel below to stay updated on all the ins and outs of your Medicare insurance. I'm sure you know that when you subscribe, it does help me out and allows others like you to find my channel. So let's start with the Plan G and some highlights. As of January 2020, it is the most comprehensive Medicare supplement policy that you can get. It covers everything at 100% after you meet or pay the Medicare annual Part B deductible. Take a look at the chart. You will see that it covers absolutely everything. What about pros and cons? It is the simplest Medicare supplement plan to understand. You simply pay your premium, you pay the Part B deductible each year, and you are done. That is it. It typically or historically does go up faster than the Plan N or the high deductible G. Figure about 10% plus or minus. Don't be surprised if it's higher sometimes. Like all Medicare supplements and like original Medicare, it doesn't cover routine dental, routine vision, routine hearing, transportation, and usually gym memberships. Who should get one? It is ideal or best for someone who has serious health issues or chronic conditions, someone who tends to frequent Part B services like doctor visits, lab work, x-rays, outpatient hospital services, chemotherapy, radiation, dialysis, CAT scans, MRIs, etc. Or someone that doesn't care about paying more to not have to deal with any potential copayments. Let's move on to the Plan N and its highlights. It is very similar to the Plan G. Take a look at the chart. It covers everything under Part A at 100%. It covers everything under Part B at 100%, except some office visits after you meet or pay the annual Part B deductible. So you will have a copayment of up to $20 for some Part B office visits. That could be from 1 penny to 20 bucks. You will have an ER copayment of up to $50, so 1 penny to $50. If you happen to go to one of the 3% of the doctors that don't take Medicare assignment, you will incur a 15% excess charge above the Medicare approved amount. Note, some states don't allow the excess charge. What about pros and cons for the Plan N? You pay a premium, you pay the Part B deductible, you potentially pay some modest copayments, and then it is less money than the Plan G. And it typically or historically goes up slower than the Plan G. Figure about 7.5% plus or minus per year, could be higher. So over time, your premium savings will get greater and greater. Take a look at the graph and the chart that I have below to see how over time the savings gets greater and greater. It's pretty impressive. Like the Plan G and like all other Medicare supplements and original Medicare, again, it doesn't cover the routine dental, the routine vision, routine hearing, transportation, and usually gym memberships. So who should get one and who is it ideal for? Someone who is relatively healthy to extremely healthy, meaning no serious health issues or chronic conditions. You take pretty good care of yourself and you don't have a history of going to the doctor and hospital a lot. It could be for someone who wants to save premium dollars and maximize that savings by potentially using it elsewhere, like a long-term care policy, life insurance, savings, paying down debt, etc. Then we come to the Plan High Deductible G. What about its highlights? It is a catastrophic supplement. It kicks in when your share has exceeded the deductible limit. Currently, in 2023, it is $2,700 per year. That deductible does go up every year and is based on the Consumer Price Index Urban. The historical average is about 2.4% per year, but 6.35% the last 2 years. So if inflation stays high and runs hot, the deductible will increase faster than previously. Based on historical averages then, in 10 years it could be $3,500, and in 20 years that deductible could be $4,500. How about the pros and cons? Well, number one, very low premium. You get 100% coverage after the deductible is met. It goes up the least, about 2% plus or minus per year. But the deductible, again, does go up every year based on the Consumer Price Index. If that average increases too much and inflation, again, stays too high, that deductible could get pretty high down the road. So who should get one? Someone that is very healthy, works at maintaining their health, hopes to stay in good health. They eat right, they exercise, they think right, they don't have any bad health habits. They won't have an issue with coming up with the deductible if the need arises. They want to save thousands in premium dollars over time and reallocate that money into something else. Again, like a long-term care policy, an investment, savings, debt pay down, whatever it may be. Realize, however, that several years with a health issue and frequent provider visits will seriously cut into your potential savings. So check out these other videos that I have. The Plan G versus the Plan N, the Plan N for healthy people, and Medicare's best kept secret, the high deductible Plan G. Also consider a Medicare Advantage plan if it makes sense. For a Medicare Advantage plan, you would want to find a good plan in your area with good prescription coverage. It has a large, stable, nationwide network and a low maximum out of pocket, and some extra benefits, and you understand how they work, the pros and the cons for sure. So what next? Typically, it comes down to the Plan G or the Plan N. You can contact me if you live in one of the states that I'm licensed in to discuss rate comparisons and options to maximize your premium dollars and premium savings. If you are turning 65, you will likely need and want a Part D drug plan. If you want my help with that, I'd be glad to help with that as well. I will review your medications and use the Medicare prescription calculator to determine what Medicare says is the lowest overall drug plan for you based on your unique medications and your pharmacy of choice. If I represent the lowest overall plan, then I will enroll you into that plan. If not, and they are significantly cheaper, then I'll tell you which plan it is and how to contact them. If you'd like me to help you review your options so you can make a wise and confident decision about all of your choices, then please contact me and we will have an open and honest conversation about what is best for you. Once you decide what is best for you, I'll get you enrolled in the plans of your choice. And after that, of course, I will be here for any help you need regarding your policies and Medicare questions that you have down the road. I hope that you have really found that valuable and helpful. If so, please consider giving it a like. And who else you know that might benefit from this, please consider passing it on to them. And if you could do me a favor, please put the state that you are watching from in the comments section down below. This does help me to determine what other states I may want to be licensed in. If you have a question, put it in the comments section. And if I have time, I will try to answer it for you. And if you happen to live within an hour or so of the Charlottesville, Virginia area and you would like to meet in person at a safe and convenient location, please reach out to me and let me know. You can go to my website where I have a lot more information on retirement insurance, plus a couple contact pages that you can use to connect with me. Lastly, I want to say thank you to all of you that have reached out to me and I've been able to help you roll into your new Medicare plans. I appreciate your confidence and trust in me. That is it for today. Which Medicare supplement should you pick? The Plan G, the Plan N, or the high deductible Plan G? I'm Chris Prang, the Medicare analyst. Make it a great day.